Manitoba's Emergency Management Organization says 7 communities, Lynn Lake, Leaf Rapids, the Wallace Cottage Association, Marcel Colombe First Nation, Matthias Colombe First Nation, Tatasqueyac, and parts of Nopaming have evacuated due to wildfires. Many of the evacuees had just returned home after being forced out of their homes in May due to fires. The uncertainty of the situation is undoubtedly having an emotional and mental health toll on evacuees. Joining us now to tell us more on how wildfires and climate change are affecting our health and our economy is U of M Associate Professor of Economics, Soodeh Saberian. Good morning, Soodeh.
Good morning.
Thank you so much for joining us. Now, you just came back from Princeton,
yes,
doing a study on climate change,
yes,
and its effect on our mental health. Tell us a little bit about, this is a research project you've been working on for 3 months, or 3 years rather, but a month ago you released a report. What did the report find?
It's a working paper, and I would like to also emphasize the role of my co-author Janet Carey at Princeton University. We found that wildfire is affecting mental health hospitalization, not only because of evacuation, proximity to fires, but also because of smoke and climate anxiety.
So what do you think is causing that?
Well, like, wildfires, I think, are new normal. Being displaced from your home because of evacuations, and also even if you are not evacuated, but proximity to wildfires can cause distress and can increase mental health hospitalization. Waking up to a smoky sky is increasing increasing anxiety. What we found is that smoke mainly increases substance-related disorder, mental health hospitalization, and also anxiety-related disorder. But what was very surprising and unfortunately sad was that you don't need to inhale the smoke or being exposed to flames. Climate anxiety is also increasing mental health related hospitalization. If I want to be more detailed, climate anxiety is chronic fear of our changing planet. 60% of people worldwide has reported suffering from climate anxiety. And our study shows that wildfires, as one of the very frequent and intense disaster of new normals time, is also increasing mental health related hospitalization.
And you're seeing this in the younger generations as well.
Climate anxiety mostly is happening in youth and families with parents. What we saw is that kids less than 20 years old are also affected because of climate anxiety, but mostly working people. Wildfire, through the channels that I just mentioned, affects working generation more, but climate anxiety is more happening in youth.
We're almost out of time already. Is the solution more money to healthcare services?
Yeah, I think the study shows that we need longer term funding, because if we are talking about new normal, which is wildfires, frequent wildfire, having long-term funding that helps with climate-related mental disorder would be a very first step.